welcome back again, answering another question from our social platforms. Thanks for sending these questions for us. We try to use them as a springboard so we can get more information to you out there. So this is a question from a gentleman, and it's an issue that's important. I recorded a video a while back on a lady who had transplants done to her temple. I addressed in that video part of the question that she had, which was trauma to the existing hairs, but she also was questioning if there was any nerve damage to the area that was transplanted. So I figured I would answer that together with this question from this gentleman here, which is the same issue. He reports that he had an FUE procedure 7 years ago in Turkey, and now he has pain in an area. He doesn't say if it's in the donor zone or the recipient area, but it says in the right on the side of his head. So I haven't seen this gentleman, but the question about nerve damage in transplants, it's important. And every time you cut the skin, there's nerves going everywhere. So in my experience of doing transplants over almost 30 years now, since 1998, thousands of patients. I've had 2 or 3 patients that had this problem. Any surgeon that's been doing any kind of procedures, not just hair transplants, for a long time, if they tell you that they haven't had any complicated cases or haven't had any problems, they're probably lying to you, because we face these things. Surgery is an art, is not, a mathematical science. So, but things can be avoided. And if they happen, of course, you have to have the knowledge to treat them as soon as possible. The problem here that he mentions is, of course, his doctor is in Turkey. So how does he get treated now? Well, I treat patients from all over the world. I do transplants on patients now. And with the technology that we have these days, it's very easy to talk to someone via camera and maybe offer some treatments. So this probably was caused by too aggressive of harvesting if he's in the donor zone. If it's in the recipient zone, it's probably the recipient sites were made too deep. But if you look at the scalp, there's a lot of little nerve branches that run on the surface. That's why we feel things when we touch ourselves. But the major nerve branches, I should say, and the major blood vessels run very deep, deeper than you should ever go with an FUE harvest. The cases that I had where there was a little nerve issue there were strip surgeries, FUTs, where we go a little deeper with the blade and there's stitches. So there's more trauma to the area. Those cases resolved and we treated them, and the patients never had any chronic problems. Certainly not 7 years of problem. This is a long time to be dealing with this. In FUE, it's important to control how deep you go with the punch. So more than likely what happened here, the person that did the harvesting or the extraction went very deep with very big punches and went close to these bigger nerve branches and caused this thing. The symptom, what's called paresthesia, that's the medical term for it. It's a sensitive nerve or maybe some numb area, or maybe it feels like itching or stinging pain or shooting pain. That's because there's nerve damage. There's treatments for this. Sometimes in the strip surgery, you trap the nerve in between a stitch or something, then you have to go in and release it, open up and release it. FUE, of course, there's no stitches, so this needs to be treated medically. And there are treatments for it. It's just, it needs to be done, because if the longer you stay with this problem without treatment, the longer it'll take for you to recover, and it may become a chronic thing. So talk to the doctor in Turkey if you are this person, if you're facing the same problem, or talk to me. I'll be happy to be able to at least guide you and give you some direction here. So there are a lot of treatment options that we can do that can help you out, okay? So be careful when you select the person that's going to do your transplant. Hair transplants are delicate procedures. We can't forget the nerve distribution of the scalp. We have to be delicate so we prevent these issues. Normally, patients don't have any problem, but if they arise, then it needs to be treated right away, okay? So I'm available for consultations, for questions, and let me know if I can help you, okay? I'll see you soon. Thanks.